But have you ever noticed a strange red, blue, or purple patch inside your mouth and wondered what it is? Let's talk about something called submucosal hemorrhage. It sounds complicated, but it's basically bleeding that happens just beneath the surface layer of your mouth, called the mucosa. Imagine tiny blood vessels under the skin of your inner cheek or on the roof of your mouth. When these delicate vessels break, blood seeps out and collects in the surrounding tissue. This collected blood is what we see as a discolored patch. A key feature of these spots is that if you were to press on them with a clear glass slide, they wouldn't turn white or fade. This is called a negative diascopy test, and it tells doctors that the color is from blood trapped under the surface, not from dilated blood vessels. So, what causes these tiny vessels to rupture? One of the most common reasons is simple trauma. It can happen to anyone. Maybe you accidentally bit your cheek while chewing. Ouch. That sudden pressure can easily cause a small bleed. Or perhaps you have a dental appliance, like braces or a retainer, that's rubbing against the inside of your mouth. This constant, gentle irritation can also lead to these colored patches. Even professional dental work, as careful as it is, can sometimes cause minor trauma to the delicate tissues of the mouth, resulting in a small hemorrhage. It's not just direct impact either. Things that increase pressure inside your body can also be a factor. A really forceful coughing fit, for example, can raise the pressure in the blood vessels in your head and neck, sometimes causing the smaller ones in your palate to break. Similarly, the intense strain during childbirth can occasionally lead to these small hemorrhages in the soft palate. In all these cases, the cause is mechanical. Something physically caused the vessel to break. These traumatic lesions usually heal on their own without any issue as the body reabsorbs the blood. But trauma isn't the only cause. Sometimes submucosal hemorrhage can be a sign of an underlying issue with your body's ability to form blood clots. This brings us to coagulation disorders, and one of the most significant is thrombocytopenia. Thrombocytopenia means you have a low number of platelets in your blood. Platelets are tiny, plate-shaped cells that rush to the site of an injury to plug up any breaks in your blood vessels. Third, the platelets might be getting trapped. Your spleen plays a role in filtering your blood. If the spleen becomes enlarged, a condition called splenomegaly, it can start trapping too many platelets, removing them from circulation so they can't do their job. Finally, there are other factors. Chronic heavy alcohol use can suppress platelet production in the bone marrow, and sometimes doctors can't find a specific cause, which is known as idiopathic thrombocytopenia. In these cases, it's crucial to see a healthcare professional to figure out what's going on. When platelet counts are low, you might notice more than just spots in your mouth. What are the signs and symptoms to watch out for? Spontaneous bleeding from the gums is a common one. You might notice your gums bleeding when you brush your teeth, or even just randomly throughout the day, with blood seeming to just stick around your teeth. Because the lining of the mouth is so delicate, even minor trauma that you wouldn't normally notice can cause significant-looking bruises. For instance, you might see dark purple patches on your cheek or tongue, right along the line where your teeth meet. These are classic signs. The bleeding isn't always confined to the mouth. Frequent or heavy nosebleeds, what doctors call epistaxis, can also be a symptom. Women might experience unusually heavy or prolonged menstrual bleeding. Another serious sign could be bleeding in the gastrointestinal tract, which might show up in your stool. If you see any of these signs, it's a signal to get checked out. And remember, a key diagnostic clue for all these skin and mucosal lesions is that they don't blanch or turn white when you press on them. Let's do a quick recap of what we've learned. Submucosal hemorrhage is simply bleeding that occurs beneath the surface of the mucosa or skin, creating a red, purple, or blue patch. It can be caused by two main things: physical trauma, like biting your cheek, or an underlying coagulation disorder, most commonly a low platelet count, which is called thrombocytopenia, and the key clue that helps doctors identify it. The lesion does not blanch under pressure. It's a non-blanching spot. If you ever notice a persistent or unexplained spot like this in your mouth, especially if it's accompanied by other signs of bleeding like frequent nosebleeds or easy bruising elsewhere, it's really important to consult a doctor or dentist. They can help determine the cause and make sure you get the right care. While a small, one-off spot from biting your cheek is usually nothing to worry about, recurring or widespread spots need a professional evaluation. Thank you for watching and learning with us today. We hope this explanation was clear and helpful. Don't forget to like this video if you found it useful and subscribe to our channel for more clear and simple health education. Stay curious and stay healthy.